Doctor, here we are again. COVID cases spiking, some health systems pushed to their limits, some overflowing. Does this inevitably end with a federal mask mandate and lockdowns, or is there a better solution?
Yeah, Shep, thanks for having me back. There's definitely a better solution. We don't need a federal mask mandate, and we certainly don't need a federal lockdown. Here's the issue. What we're seeing is surges of infections in communities with low vaccination rates. We're seeing little bumps in cases in places like Vermont, Massachusetts that have high vaccination rates, but they're fine. Their hospitals are fine. They're not likely to get overwhelmed. So I think what you're going to really need to do is localize policy, and you're going to have to find some ways of both increasing vaccinations and controlling the virus until more people get the shot.
You know, the CDC and Dr. Fauci said today that they're not advising a booster shot for those who had J&J, but a whole lot of doctors that we both know and have interviewed say they're already recommending it to their patients. How do you see this? Is it just another example of the government being behind, or is there something else here?
Yeah, there are examples of the government being behind. I think, for instance, the FDA is taking way too long to approve these vaccines. I don't understand what's going on there. The J&J booster thing, I think, is a little different. I think the data on this largely leans towards people not needing a booster. That's how I read the evidence. And, look, we're going to have more data and more evidence coming probably in the next few weeks. What I've been recommending to friends, family, colleagues who've been vaccinated with the J&J is hold tight for a few more weeks. We'll have more data. I don't think we need boosters necessarily for J&J, not as of based on the data we have now.
You've heard from the former FDA commissioner, Dr. Scott Gottlieb, our contributor, who's predicting this spike in cases could peak in August or early September. And yet I keep hearing and have heard for more than a year, this is a winter virus. It does better when it's cold and less humid. What's your thinking on a timeline, if that's even possible?
Yeah, it's hard to predict. It is a winter virus in the sense that it does do better, but this version of the virus, the Delta variant, is so incredibly contagious that it's happy to infect people. It's happy to run at any time of the year. If this were winter, this would be even worse than what we're seeing right now. So thank goodness it's at least happening in summer, where in large parts of the country we can largely be outside. And I don't know when it'll peak. It might peak in September, but we are far away from the peak. Right now, we're doing 40,000 cases a day. It's going to go substantially higher before it peaks.
You know, my doctor gave me sort of a crude way to understand this and said, you know how sometimes you're speaking really loud at a game or something and spittle comes out of your mouth and then it falls to the ground? That's the previous virus. The Delta version is more like blowing smoke out of your mouth, and it floats all over the room. How would you describe it?
Yeah, that's a really, I like that analogy. I certainly like that in terms of blowing smoke out of your mouth. If you think about it, you walk into a room, somebody's been smoking, you're going to smell that. And the truth, of course, is you can't smell the Delta virus. And this is why it's so contagious. And this is why being indoors, if you're unvaccinated, is so incredibly risky. You can be 6 feet away from anybody else. But if they're if they're infected with the Delta, your risk of getting infected is really quite high.
I'm worried about the next few weeks, and not because of anything I know, but because of people like you I talk to, like really worried.
I am too. I think people are underestimating how bad this is going to get. We are in for a very tough August, probably a very tough September before this really turns around. And the best way to turn this around is to get people vaccinated.
Yep. Dr. Ashish Jha, thank you. Shepard Smith here. Thanks for watching CNBC on YouTube.